Welcome to the Back in Action podcast, where you're going to hear from me, a spine physician, Dr. John Lavelle, and two coaches, Dusty Holden and Josh Bunch. We're going to help you rethink pain, rebuild strength, and regain function so you can get back to enjoying the things you love in life without limits.
Welcome to Back in Action, a podcast where we choose performance over pain. With me today, Dr. John Lavelle and Coach Dusty Holden.
Hey, man.
Thank you for coming. Today, we're going to talk about what people get wrong most, ourselves included, with health and fitness. So we should cover that in about 10 minutes. Dusty, I want to start with you. I feel like we're going to share, well, there's a reason I want to start with you. I feel like we're going to share a lot of sentiments, and you terrify me. I feel like we will have a 2-day conversation about what could potentially wrong about what it is that you do. But Dusty, I wanted to kick off with, what is one thing that you get right today, or more right, that you got wrong before?
In regards to
fitness, health, whatever you got, you toss it out at me. I think that anything that we cover today is going to be valuable to somebody. So what you got?
Well, I would say today, it's really probably just the understanding of the impact that I think when I first started in fitness, I did it more for the aesthetics of it, like what the outward benefits. I think now today I understand that, like, I'm still discovering benefits that it has on my life. So it's funny how that as you age, now I'm in my mid 40s and I work out more for my sanity than I do for any other benefit. It's like I love the obviously the aesthetics of it as well, but then it's like just your overall health, and now the mental health.
You talk about like cognitive wellness, antidepressant.
Yeah, and just like the way it resets and helps me just kind of realign, my mindset. Yeah. Because that's like, it's true. That's another thing that I don't know that you ever like really fully arrive. It's like this battle that you're in every single day, your mindset, and even working out. Me and my wife were talking about it the other day. I think you the longer you do it too, it almost becomes more challenging. Like you gotta kind of be very intentional about
not getting that PR every single time.
Exactly. Like it's not as gratifying instantly. Right. So that's right. It's one of those things where you've got to like be even more intentional, and you have to just keep reminding yourself of all the whys. It's like I feel like you just keep as you age discovering more benefits of what like fitness and movement, the impact that it has on you, and it's stuff that you hear about, but it's different when you start to experience it.
What's another one you would say besides, antidepressant, cognitive wellness? You're sharper through the day. What's another one that most people that aren't working out would eventually notice if they started working out today?
Well, I think you'll sleep better.
Okay, yeah, totally.
So I think it has an impact on sleep that you don't even really like.
You don't know until you tried it.
Exactly.
Yeah. Okay.
And if you're not moving and you're not sleeping, then I guarantee you, if you start moving and training a little bit, your sleep's going to improve.
When's the last time you took more than a week off of fitness?
That's a great question.
Has it been a really long time? Like you can't remember it? I have a even more reason. Yeah. Same question. When's the last time you took more than a week off of fitness?
Probably 2012.
Okay, so you even got it like down 2012. The reason I ask is
because I started fellowship then.
Okay.
So I bet when I was moving, I had stopped. But when I moved from Dallas to Knoxville, and then met this guy over here, started training with him, which was 2015-ish.
That's it.
Definitely not since 2015 have
I
I taken a week off.
Yesterday just talked to me about that, said that he had knee surgery, and this was around 2016 or something, said he had knee surgery, and he's like, the doctor said for 2 weeks I wasn't allowed to do anything at all. We won't argue about that piece or whatnot, but we
can argue about that because that's BS.
Okay, fine, I won't do anything. And he said, I thought it would be really hard, and for the first 5 days, this is a guy who works out every day, has for his entire life, he said that for the first 5 days he was great. He said by the time he got to day 8, he was just in a really bad, dark mental space. And 100%. That's when he reached out to the doctor, and he's like, I can't do this anymore. You have to let me do something.
Especially if you're used to doing it.
That's right.
That's your body.
Your body
has that physiology where you need it.
That's
like
what made
any
me
drug,
think of, though,
really.
people that have never done it. What is their everyday like? If that's what it's like for somebody who does it every day and then goes away from it, do we just not know what we don't know?
Well, yeah, and I think you adapt to
feeling bad.
You do. You don't even realize that you are feeling bad because you don't know what feeling good even feels like anymore because it's just been so long. It's like sunshine, you know. I mean, this past week we had some really nice weather, and then Sunday we get this and it was just dark. And even by the end of the day, like my mood was like, I felt like I was in a funk, and I didn't know why. And I was talking to my wife, and I'm like, I think it's the sunshine. Like the sun never came out, you know? And so you don't get many days, especially here in East Tennessee, where the sun doesn't peek through a little bit, you know? But that day it was like, no, man, it was just gloomy.
Not working out is like stealing the sun from you.
I mean, I think so. And I think that's like, you know, like you said, your client who gets 5 days in.
That's right.
And you're like, what's wrong with me?
Just fell off a cliff.
Yeah, it's like your norm has just shifted. And I think for most people, it's always a slow fade. You know, it's like because your body is designed for movement. You know, that's it actually it thrives on it. So if it's not getting it, then as time goes on, it just kind of adapts, and you don't even know. You don't know how bad you even feel. Yeah. You may see. You probably see glimpses. That's always what I hear from folks is, well, I got out in the yard and I was trying to play two-hand touch football with my kids, and I can't even run or keep up with them now. Or, you know, there's some kind of trigger event that catches you off guard. Like you realize that I can't do that anymore. Yeah. And I used to do that. And then you start thinking, like, well, what's wrong with me?
I think that's the biggest thing people see. Like you started out with, like, what do people see when they start that fitness journey? The biggest change, I think it's, they may sleep better and the other things Dusty talked about, but they're going to just notice within a short time, if when they start moving, they're able to do more, whether it's just around the house, go out in the yard, plant their flowers, be like, I haven't been able to do this for years. And you haven't changed that much. You've just started to train those muscles.
The harder the intensity in the gym then makes everything else in life quite a bit easier to do. Absolutely. And you can do more of it. Okay. Now, Dusty said something that's really interesting, and I agree with, and I've heard a million times. I wonder if you could explain it more medically. If it makes you feel so much better, why is it that it feels so bad in the beginning?
Working out?
Correct. Yeah. So, well, is it just because it's different?
It's hard.
Okay.
I think that's the biggest one. Like,
it's just hard. Yeah. Because it does feel horrible.
Because you have to be intentional about doing hard
things. But to be really
nobody's
honest, even the warm-up
come on.
Hard. But the warm-up is hard every single solitary day. Yeah, I think for anybody,
it's like getting started.
Every single time.
It's the start.
Is there a medical reason for that we're shifting something that it really does feel uncomfortable, or is that just the novelty of activity that it feels bad in the beginning?
Neurologically, it's makes us uncomfortable. So in our brain, we want to stay in our comfort zone.
Okay.
With our physiological levels, hormone levels, we're in a good space. But if you feel crappy in that good space, you know you need to make a change, but it's hard to take that step out. So it's insecurities. If you're going to a gym, working out, I haven't worked out in 20 years. I'm a little overweight.
So there's a lot more than physical that goes into that.
Of going in there. So it's that frontal lobe response. And then it's also in the amygdala where you have that fight or flight response. You have that little fear of going in there. So you're pulling back. But then when you make that jump, it's also hard because you're going to be sore. And you know, you have that, you're using muscles you haven't used in a long time. I think that's the biggest thing that keeps them from continuing that journey is they get sore after working out. So
and
they
that
think
could
they're
be
getting
a relation to poor programming, though.
And that's not good.
Right. They think they're flaring something up or making something bad, where it's just normal. Anyone that goes to the gym, if you're doing it correctly, you're sore the next day or two a little bit.
But in truth, though, and we're really good about this in terms of programming, like there's a soreness that should be fine, especially if you haven't done anything, but there's definitely a wrong.
Oh, yeah.
You have definitely done that wrong.
Well, and I would say the goal is not for you to be sore.
No, not at all.
You know, it's not.
And that's not what. But soreness doesn't mean you had a good workout.
No.
Right. Okay.
But it also, in turn, it could mean it was good. Yes, right. It's just, I think it's not, that shouldn't be the focus. Like that, we shouldn't be running toward
being sore.
Yeah, being sore, and associating that with like, oh, it was good or bad. Same thing we talk about with conditioning. It's like it doesn't take a really, really knowledgeable coach to lay you on your back.
Right. That's exactly
you can throw a lot of stuff at a whiteboard.
Hard workouts are easy to make up.
Exactly. And so don't judge the workout based off of how it ends, or where you're at when it's over, if you're on your back or you're standing. So I think all that comes down to, some of that is just knowledge, be educated enough to understand, all right, this is good, this is not. I think though I think the battle really is between the ears though. And it's like what you were talking about. It's why we hear so many excuses. It's like, well, I've got this injury, or I've been out this long. The list just it goes on and on and on of all the reasons why you can't do something.
And really, those excuses should be the reasons to make you go do it.
I think it's all the more. Sure. It's like every one of those things that you just said.
That's why
it's another reason, to get in and to do it. So it's really just reframing the way that we approach, I think, fitness. I don't know why. I think it's like you said, we're just kind of we have this just urge to be comfortable.
I think so much in healthcare, from my perspective, fitness is always thought of, working out, going to the gym because you're trying to accomplish a goal. I want to be a better athlete, better baseball player, better football player, or I'm training for this competition. And it's slowly changing, but fitness needs to be thought more of, that's how you prevent chronic illness, whether it's chronic back pain, heart disease, obesity, cancer.
So you're saying add more metrics to what you say. So you said, I started for an aesthetic. It was almost like your entire reason. You're not saying it's bad to be aesthetically motivated. Like, sure, it's great to want a bigger biceps, but what you're saying is like, cool, do that and do this, but also just do it.
Well, it should be taught in elementary school, fitness. And it used to be back in the 30s and 50s, you would go and you'd be push-ups and do gym class. Now they take away gym class, or you're just playing, stack the cups or something like that, which is all good, but also teaching them the importance of fitness and how it relates to health. And that if you teach a child that at a young age, they're just going to realize that's just part of life. And that's what keeps me healthy throughout life. And if we did that, man, we spend 90% of $4.9 trillion on healthcare on chronic illness, mostly at the end of life.
So is that
small, tiny sliver on prevention and true health care delivery?
So is that what we get wrong the most out of healthcare? Is that so little is spent toward prevention and so much is spent as rehab?
Absolutely.
And after the fact?
I mean, we treat disease. Medicine now is disease management and chasing symptoms after they happen. It's like if you're driving a car and you have an old rusty car and you just let it go. Well, eventually you're going to get a flat tire. The oil's going to be out, and you die on the side of the road. And you need an emergency fix. So you can either, patch that tire, top off the oil, and you're good to go for another couple miles. But what if you take care of that car? You get an oil changes, you make sure the tire is in good shape, you take care of the car, then it's going to last a lot longer and have a longer life. Same with us.
So and this is way too broad of a question for something like this, but how, if a surgeon, for instance, is rewarded for surgeries,
how do you change that?
Yeah,
you need policy change. And that's where it comes down to. Because you're right, it's a fee-for-service model, is what you're saying. So we get more money if we do procedures, if I do injections. Medicate. If you provide more medications, well, then you're going to get good lunches by the pharmaceutical reps. So yes, you're incentivized to the specialists make more money because they're doing the procedures. There's higher billing codes for being a consultant versus the primary care physician. They're often doing less procedures, but they're the boots on the ground that are seeing their patients more frequently and trying to drive that preventative care. But it also comes down to volume. So if you're not getting paid for a procedure, you got to see more patients. So what can you get done in 10 minutes? Not a lot. But if that patient was being seen for their quality of care and the value you provide and keeping them healthy, as a physician, if you were getting reimbursed for that, you could spend 30 minutes with them, get
reimbursed at a higher level and you've truly helped a patient versus the 10-minute visit where you say, here's a medication, I'm going to send you to this specialist to inject your back. And so the specialist will make money, you get them out the door because you can get the next one in quicker. It's just a
What went
messed
wrong
up model.
first? Was it that the culture wanted a fix that didn't require effort? Like, I didn't want to go to the gym. I would much prefer a shot. I would much prefer a surgery. Or was it the other way around?
I think it's a culture, but also we know much more about prevention now than we did in like the 50s. So
there's an education piece too.
100%.
Yeah.
So when
education
came,
work? When you educate, so if you told somebody that,
100%.
It would. Okay. So I would listen to
The
you.
tool I use in the toolbox is education for my patients, explaining what's going on, not describing their symptoms. And that's where we've gone awry, is so much of it is listening to symptoms and trying to treat that, whether it's going to physical therapy and trying to treat the symptom of the back pain to get them out of pain. We got to treat the root cause. So that's really what it comes down to, identifying what's causing the problem and treating that versus treating the chest pain or treating the back pain or treating the cancer and minimizing the tumor when it's developed versus how could we have prevented that? What's the root cause that caused that tumor or cancer cells to start to regenerate and populate? What caused that heart attack with the coronary arteries getting clogged? What caused the back pain? Don't just treat the symptoms on the periphery. Let's get in the middle and find out what's wrong. Because then once we do that, you can reverse a lot of things, diabetes, heart disease in patients that already have it if you treat the root cause.
Yeah.
But we also, if we start young, like I mentioned, starting young with fitness, we also teach them proper nutrition, sleep, getting sunlight, staying hydrated.
Yeah.
Ingrain those in our younger population now. We're going to save so much in healthcare dollars down the road. But you're right. Then the physicians that are treating all those symptoms on the periphery are going to make less money. So how do you change that?
How does somebody that hears that doesn't have a you, those things are great, but they don't have you saying that, they're hearing the opposite. They're having somebody that they're with today that's treating a symptom. What is the first step you would tell them to take to treat the root cause, not to go after the symptom? If they had to do this on their own.
Talking about lifestyle changes. So one, movement. I would say there's probably 5. Movement, nutrition, sleep, hydration, and getting some sunlight in the morning.
Okay.
Those would kind of be the 5 things I would push and describe them. You can describe that in less than 10 minutes. But you can't just say when it comes to movement, go to the gym and lift heavy things. They have to have some guidance with that. You don't want to just start somewhere. You got to kind of start slowly and build it up. But movement in general, whether if you're at a desk job, just get up every 30 minutes and walk or do a wall push-up or a wall sit and start to move those muscles. Go for a walk, 30 minutes every day would be my recommendation.
Yeah.
Find the time. We all have the time somewhere. It's where we utilize our time. Nutrition, don't just eat less, but eat more fruits and vegetables. Get some color on your plate. Try to switch out one sugary drink or diet soda for water. Make little changes and that will compound because you will see the difference. Every morning get up and see the sun, or if it's a cloudy day, still go outside. That's going to make a huge difference with our immunity and it boosts mental health as well. Sleep, go to bed by 10 o'clock, put the phone away at 9 and be asleep at 10. All this is going to improve mood. It's going to improve health.
Yeah.
Well, I think the big things, the 5 things he just named are readily accessible to everybody.
They're not really that sexy.
No, and it's realizing that, hey, you actually have more control over your health than what you think you do.
Sometimes that's terrifying.
And I think people right now, we've been conditioned to kind of like go to the doctor to find out what they tell us that's wrong or we need to do, when realizing like, hey, you already have all these tools available to you and you don't have to go anywhere. All these things, the 5 things that you just named off, everybody has access to that.
That's right.
And so it's just taking control of your health and not just being in this system that kind of just, I feel like just passes you around.
Yeah. And here's the hard thing. I mean, you're right. It's easily accessible. The hard thing as a physician is, and this has happened to me this year, I would say hundreds of times, where I will just have this conversation with patients, won't prescribe a med or any advanced imaging or an injection. And so I'll code a certain level based on the time and the energy I put in discussing it with these patients.
Yeah.
But on the back end, insurance downgrades my code, so I get paid less because I only talk to the patient about this.
That's right.
It's
So that's the other thing too.
But what we know about the coding is, and this is just from what I've got from speaking to other healthcare professionals, you have like a 1 is this, a 2 is this, a 3 is this, and you get
1 to
billed based
4,
on whatever
1
it
to 5.
is. And then you kind of get to decide what you think it is.
Yeah.
And
there's metrics for it based
sure.
on what you do and how much time you put in.
Sure.
But this company was just, I guarantee they were just using AI, and they were looking at the code I put at the end for the billing, not to bill insurance for the money, but the diagnoses codes. And what I was putting in there, they would downgrade based on that.
But this is exactly like what you were talking about.
Yeah,
Like,
and
what you did was the thing that was best for them, but the way that culture looks at it like it didn't really do anything.
well, that's because our medical system doesn't reward health.
Yeah, no, it doesn't.
And so I think that's what's got to change. It's like I think about my situation. I probably pay $25,000 a year for health care for my family.
Okay.
Last year we had no doctor visits. So
$25K for nothing, essentially.
yeah, it's a kind of like a worst case scenario
Sure,
for me.
but in general, you didn't use that.
Right.
Yeah. Okay.
Where would it wouldn't incentivize me because I'm already incentivized to be healthy. But for somebody that maybe doesn't see the value in that, if the insurance company offered me $5,000 back, so I pay $25,000, but if I use none of my coverage,
You get like a rebate.
I get a $5,000 rebate at the end of the year.
Yeah, cash
that's an incentive.
Yeah, that's
so
true.
I think the system needs to flip to where it actually rewards health.
Yeah.
Because right now you're really, I don't want to say penalized, but there's no value
benefit.
in it.
Yeah, no benefit.
So it doesn't save you money.
Yeah.
Actually, in most cases, probably costs you more.
Yeah.
What if, as a physician too, like you mentioned, that's a phenomenal idea. Unfortunately, insurance is just charge you $30,000 and give you $5,000 back, but because they're for profit and they're not going to take money out of their pocket.
Yes.
But what if, as a physician, you were reimbursed for your value? So let's say X patient had chronic low back pain for years, but at the end of that year, their back pain was gone. They weren't utilizing those services. What if
100%.
someone had heart disease and they've reversed their heart disease, so they don't need the medication, they don't need a coronary artery bypass graft? That's a lot more expensive to pay for those procedures. But if you've gotten rid of that, why not reward the patient, but also the physician for treating them?
And I think it has to flip to where there's an incentive on both sides, on the medical side and on the customer side, to where you've got an incentive outside of, I think everybody's goal is to live, long, healthy lives. But if you're somebody that doesn't necessarily motivate you, I don't think no one is motivated by not feeling their best. You want to feel your best.
That's right.
So here's the 5 things that you can do. And if you do those things and you're not utilizing this service that you're paying for,
Yep.
That's where it's got to flip. And I think more people, you can motivate people with money.
Yeah.
And obviously we've seen how it's flipped, because I don't think it's the intent of the doctors. It's not their intention to get people in these, in the pipeline and get them caught in this loop. But unfortunately, because that's how everyone makes money, it's really just what happens. You get tossed around, and you can't get out until you realize, I've got to take control of this situation, and I've got to do some things, personally to change it, or I'm never going to get out of, this loop that I'm in.
Now we're pretty smart, but we're not the first people to come up with something like that.
We're not.
Nobody's done it, and that's the interesting thing.
And that's the problem. No one's done it.
Is it really that hard to set up some sort of situation where those sort of rewards?
No, and it's becoming
happen?
more popular. I think, like Dusty alluded to, physicians I would say almost all, go into medicine because they want to help people and make people better.
Yeah.
Okay.
But you get put in the system, and it starts as early as med school. So many med schools are funded by pharmaceuticals. So right then and there, you're pushed medication.
It's already conflict of interest.
And when you're learning in med school, and it is such a grind, you're working 100 hours weeks, whether it's in the classroom or then in your rotations, it's hard. So you're just trying to survive.
Yeah.
You're learning what you can, and you're learning a ton of information. And that right away is you're overloading people, so they're just spitting out answers. And that translates to when they go into clinical practice, they get inundated with patients having to see volume, and they're just spitting out answers instead of truly taking the time to understand the physiology, what's going on. We're not learned as much about in med school treating health, it's more treating disease. So you're learning you go through your cardiac block and you're learning about cardiovascular disease. You go through your endocrinology block and you're learning about diabetes and how to treat it. But much less time, if any, is spent on how to prevent it. And so that's how you come out of school. Well, I just got to do this. And it's still with the right intention. You're helping people, but once they have the problem, what about preventing that problem?
Well, and I think, what we're talking about as far as like a rebate, that's probably a long shot. It would take time to get to that point. I think in the immediate, healthcare it needs to pay for people to train, to move, to go to the gym. And I think we're seeing a little bit more of that, but I think it's got to become more of the norm, like that all the providers are.
So if you could
supportive.
prove that you worked out 4 times a week, you get X amount of
it could save on your premium,
or your premium is less. So
I think that
your job, where you work at, that provides inserts. If you're willing to do X, they will do this for you.
I think it's just, again, incentivizing people to do what we all know prevents, sickness and chronic disease and all these things. And so I think that would be a good first step from a healthcare standpoint to just get to motivate people. Because we've got to get them. Our experience is once we get them into the gym and we get them moving, we don't have to sell anything.
It's like a self-fulfilling prophecy. Like you just keep coming. Once you've been in it long enough.
100%. And that goes for weight loss, pain, whatever it is. Once we get them moving, it really starts to kind of, snowball and compound, so to speak. I was
having this conversation the other day. I said that there's the folks that have a New Year's resolution that start out, they'll start out with full vigor. But then about mid-February, they probably have an itis or an osis that comes up. And then that's where you and I get contacted. But what's really interesting, and I was really thinking through this, not everybody, a lot of people that start out with the singular aesthetic goal, I want to lose weight. Maybe that's not just aesthetic, but primarily I feel like that's an aesthetic goal. They tend to maybe start and not really continue. Somebody that starts that, they get a little flared up, then they get passed along to you or I, somebody like us, and then they continue. So I thought about a lot of people that I've met who started with some goal that wasn't with us. Not to say that we're ultimately special, but that the way that we taught fitness to being a habit, like you're talking about, with more metrics than just aesthetic, people all of a sudden continue.
Well, and the thing is too, is the way we approach it. We don't approach it like there's an end.
Is that because we've seen it for so long? We don't train like there ever is?
No.
Or is that because we've learned things that again, like we're talking about now, the things we've gotten wrong over 20 some years of doing this help us to be more right?
I definitely think our experience is it really has shaped how we approach and how we train people today. But I think when you go into something and you're not focused on the finish line, it changes the process and the outlook.
So if I want to lose 20 pounds and I lose 20 pounds, what do I do?
Well, and I think that's where people get discouraged, because I think, based again off my experience, you have to have a goal. You need goals. You got to set, and those goals change as you obtain one. You create another, and they look different. Sometimes it's running a race. Sometimes it's losing a few pounds. Sometimes it's like, all right, I just want to do things that I haven't been able to do. Maybe it's playing with the kids, whatever. Those are all still goals. You need incentives, because I think if you don't have those things and little marks that you're working toward, that's where it gets as time goes on, you do lose a little bit of focus. I would say where we bring value is because we keep people on track. And I'd say when you're off on your own and you're left to your, own ideas and all these things, then that's where you can easily get off, in the weeds, or you fall off. Because we all know when you take a week off, it's not like you're like, oh man, Monday, I can't wait to get back in the gym. What ends up happening is it's actually the opposite.
That's right.
You're like, man,
everything is in the way.
Yeah, I'm really, really busy on Monday.
Yeah.
I'm going to start back Tuesday. Tuesday turns into Friday. Friday turns into 2 months, and so that's how it goes.
How do you keep the goals adjusting enough based on the person that's been in it for a while? So you and I talk about this off the clock a lot.
Yeah.
We're probably not deadlifting 800 pounds tomorrow. We're probably not going to set a PR on this. So you can't really use those hard and fast measures that we could use 20 years ago, especially not with somebody who's been in fitness for a while. What do you do? Is the next goal just something novel? Hey, you've never run a 5K. We're going to run a 5K. Or is it something more like, hey, you can't get off of the ground without using both hands. In 2 months from now, we're aiming at that.
Yeah, do something.
So you just pick something, and that's your target, and then your next target.
100%. I mean, and like I say, sometimes it's going to be something like really cool. Like you're going to, do some event.
Yeah,
and those are always fun. But we all know too, even when the event's over, it's like, it was cool, but now what? So
that now what's a big question.
It is.
That
and so
really
I think
need to be able to
then that's where you just got to reframe like the way that you approach it, where again, it's not about an end. It's the same thing like in business. Somebody says, well, when do you get to the point where you don't worry if you're going to go out of business? It's like, you don't.
You probably always worry about that.
You don't arrive, I mean, you make progress, and definitely the concerns of today are not the concerns that I had 5 years ago.
But that's why you're also a good businessman, because you've adjusted what you're concerned about.
And I never ever believed that I got it figured out. It's like I'm on this journey and I'm always learning. And so I'm figuring out that like, oh, that can be better. I shouldn't have done that. So fitness is the same way,
This is what you and I do, though, with an athlete. So when an athlete is athleting, they should not be paying attention to all of the things that we're paying attention to.
Right.
We spot very simply, without the need for fancy $1 million equipment that says, hey, that right side landing is suspect.
Yeah.
We are going to work on it. We don't even need to tell anybody that. We just notice it, and then we can put it into effect. But we could give a metric if we wanted that says, I want it to look like this. Here's what it's going to be. Yeah. Here's the amount of weight that I want you to be. And that could be the goal. So that's what the value could be with somebody like us, somebody who's working on it alone.
Well, it's really just a sounding board, man. Somebody to help you process through it, and somebody that I think you should be searching constantly for the blind spots, And so that's really what our job becomes after a certain time is like, man, we're just here trying to help spot blind spots,
and who is really, truly in your life that's 100% about you, for you, and on your side. I mean, really, I try to think through this a lot. That as a coach, like I'm 100% pro you.
100%.
I'm just watching.
I mean, everything we do is geared around that person.
Yeah, you just want them to be better.
But even if it's a group, it's like, hey, collectively, I'm looking at the group and I'm doing things that help the group.
Right. And theoretically, if you're thinking of like, let's just arbitrarily pick like a deadlift, it's not comfortable for me to go over and tell you, hey, your deadlift is suspect. Here's what you're doing wrong. I don't do it because I'm being a prick.
Right.
I do it because I want you to truly be better, stronger, healthier.
And more, I think even for us, is like, we want you to do those things.
Right.
Like, we don't want you to do it wrong and then you be like, oh, deadlifts are bad. No, actually, we want you to continue deadlifting. So therefore, that's why we kind of keep trying to help you refine it.
Yeah.
And that's, I think, again, it's all in how that people approach it. It's your mindset to it. You're never going to arrive. You're never going to be as fit as you want to be.
Yeah.
You're never probably going to be as fast as you want to be. And I think that's normal. And that's the way it should be. And so keep your head down, keep working, and then keep also searching for the blind spots. And that could be a coach, It could be a training partner. It could be anything that just helps identify those things. And I think where you get into trouble is when when you feel like you're not working toward being better at something, that's when I would get concerned. Mm-hmm. And that's definitely a time for intervention, change of path, whatever that you might decide on. But I think that complacency is that's the thing you need to be scared about. You don't need to be scared of the deadlift. You don't need to be scared of, the gym. You need to be scared of complacency. And that's really too why people get into the, situations that they get into with pain. And
well, I think
it's like you get hurt, but then you get complacent and you're scared and you now go into this very fear-minded approach. And so that complacency over time, it just sets in, man.
Now the
and
momentum is gone.
Well, I think giving people a goal is so important. So as I had mentioned earlier, and you were just touching upon, when people don't have that goal, whether it's being an athlete to play a sport, a competition or something, it's hard to go to the gym.
Yeah.
But if we reframe that from a medical standpoint, and frequently, not just once a year, doing a basic labs, which is a CBC, looking at their blood count, or electrolytes, which is so basic because that's what insurance covers. Spread that out and look at a more broad spectrum. What if when they come in, we're checking, their blood count, their electrolytes, but also looking at other markers of health? What if we have them do VO2 testing in the office? What if we look at these metrics that are proven to help with health and longevity?
Right. Mm-hmm.
And that's people's goal. I want to keep my, cholesterol at a level. I want my blood sugar kept at a level. But how are you doing that? And if that started at a young age, through their life, that's going to be constantly looking for that goal to maintain a level, or if something gets out of whack, you can then know, well, for the last 10 years it's been here. What have you done differently? Well, my cousin opened an ice cream shop, so I'm having ice cream every other night. Mm-hmm. What's off, and then truly fix that to bring it back in line. Or, I got a new job. I haven't worked out in a month. I've been stressed. My cortisol levels up. I haven't got a new job. My triglycerides are up a little bit because I'm eating crap driving to my new job. So you can more efficiently attack the outliers if you're constantly following these things. And I think most patients, are going to want to try and achieve a good score, just like when they're in school, they want to achieve good scores. It's no different. But changing that perspective on how to get that versus waiting till it goes out of whack and trying to bring it down.
Now so when people see like me work out, they're like, you're a coach, you're supposed to work out. It's interesting that when I talk to your patients, athletes that you sent me, they're like, he works out. Like you can tell he works out, and they like think it's like a celebrity sighting when they see you. So tell me, if you're the guy who's been doing this for a really long time in your own personal training, what have you been specifically wrong about? Maybe that's something that Dusty taught you when you met him that you're like, oh, cool. Again, from your perspective, not from guys who are expected to work out.
I would say, speaking on the fitness side of things,
yes, sir.
I would say two things. One, the movements should be more functional. So mimicking movements that we do day to day.
So is that how you would define functional movements that you would do outside of the gym?
Yeah, that mimic day-to-day activities is kind of how I view it and discuss it with my patients. Squats, deadlift, snatch, all those things you're doing every day. So then you're going to be able, if you can do them in a controlled setting in the gym.
What's the antithesis to that? So what's a non-functional movement?
So just sitting there, which is what I used to do. Let me just step back. The second thing I said, doing functional movements, and two, doing a variety of movements. So in the past, I would have my Monday, Wednesday, Friday workout, bis and tris, chest and back, and leg day. Legs and shoulders, we'll say. And I would always do the same movement. So I'd just be doing bicep curls, tricep extensions, and
leg
the next
extensions,
day,
hamstring curls.
Exactly.
So compound movements, implementing more compound movements.
So single joint movements that are more isolation is a lot less functional than a compound movement that's multi-joint.
Those can help you look good in a picture,
okay,
but they're not going to as effectively help you day to day.
Got it.
So instead of doing the leg extension or leg curls, I'm doing deadlifts or squats or lunges, things you're doing every single day anyway. Or I mentioned a snatch, which is a complex movement, but it's picking something off the ground, bringing it overhead, something we do every day.
Yeah, that's right.
So exactly, more compound dynamic functional movements, but getting variety in there. So I don't have a leg day per se, or I don't have a chest day. A lot of that's intermixed. You know, one, it keeps it more interesting where every day you go into the gym, you're doing something a little different.
Yeah.
But also you avoid that kind of plateau where your muscles are constantly being challenged in different ways. You maybe still be using the shoulders, but you're doing different movements with those shoulders. So those would be the two biggest things. You got to get variety and doing more functional movements.
And described basically the definition of CrossFit, constantly varied functional movement performed at the utmost of intensity. Tell me how we've misinterpreted intensity. How maybe you have. I know I have. What have you done in terms of intensity that you have changed over the years?
Well, I think intensity is thinking that it's like a sprint, all out. I'm on my back.
Right.
That's the only type of intensity. And so it's now there are times that it calls for a max effort, but there's different levels of intensity, and I think that's another thing that, as an athlete becomes more experienced, is helping them understand the different types of intensity.
That and when to do which one.
And that you don't, I mean, there's no possible way that you're going to be able to come to the gym and every single day max effort, every single thing that you do. It's just not possible. And if you do, you probably won't be training long.
That you're not reaching your potential.
Right.
That's first and foremost. You're going to be under-recovered, and spending long enough time in an undercovered position makes you in an injured position eventually.
Yeah.
Okay.
And so, but also understanding that like there's a time that calls for you pushing yourself to those max effort, ranges, because there's a lot of opportunity, there.
And this would also be a benefit to help with a coach that can talk you through how many of when these are necessary per person based on what they also have going on in their lives.
Yes, and I would tell you too, like that intensity is something that should come once that you have developed a baseline and you have a level of experience.
Mechanics, consistency, intensity.
Yeah, it's not just get into the gym and start getting after it. I think that's another, it can be a common mistake. It's like you get motivated, and so you're just, you do see some results, and then you just start going nuts, And so it's, hey, learn to move safely and effectively, and then get the consistency part down, And then once you've nailed down some of the fundamentals of training, then that's where you can start to, that's the fun part. It's like, that's where you can start to introduce, different things, different levels of intensity, understanding that, picking a day that you're like, hey, you know what? I feel great today.
Yeah.
This is the day that I'm going to really, really, push it. And so, and then also understanding that on that day where you don't feel great, that guess what? There's still opportunity, to get in and train and move, and not comparing those days. It's like one's not better than the other just because that day you felt great and went max effort, Yeah. So it's a lot of it is like, again, it's things that you learn through, trial and error, and also just the process of it. I would say that's really what is the most rewarding thing, I think, in anything, not just training, but even in you write. Mm-hmm. It's like you don't really, it's not about the end when you get the book. I mean, you got 4 books written, man.
Mm-hmm. Just keep going.
Right. It's like the journey of you getting there. That's really where the growth happens. And I think that's what people need to understand.
Well, and I think that's a good analogy to go on is most people think of the gym as a place anyone can go, just jump on machines and do it, which I try to tell patients that you need someone to guide you. It's like playing a sport. anyone can go swing a tennis racket, but it's hard to be effective and do it correctly. So someone has to coach you along, which is how I view fitness. You have to have someone guide you and teach you what to do. Similar as writing. Anyone can write, but can you write well? And so the more you do it or have someone, editors reviewing it, you're just going to get better and more effective at it. And eventually you can go alone and do it. But it's the same thing with walking into a gym. Yes, getting in the foot in the door is good, but you're really going to maximize what you do if you have someone kind of guiding you along on how to do these functional movements, how to do it with the proper intensity. So it's a safe. So that's why I mentioned earlier on, if we start that at a young age, imagine if, young teenagers already know how to do these movements.
Right.
It doesn't mean they're doing it with heavy weight. They're just doing it maybe body weight or with, a simple little PVC pipe, but then they know what they're doing. When old age starts to kick in, you get more degeneration, you already know what you're doing to prevent the symptoms of that old age from hitting you.
Would you say that when you talk to your patients, like one of the way that you enter them is that sort of conversation about education, like, hey, these guys are not going to start you at 10 intensity. They're going to put right where you're at today is where they're going to start you at. Would you say that that's the simplest way to break through that whatever wall you've put up about fitness is to know that you're going to see what you can tolerate well before we throw you into the deep end in 100%. Terms of fitness? Okay.
Yeah, because so many of them are scared to come in and go to a gym or a gym like Armor Gym or a CrossFit gym. One, if they hear CrossFit, they're scared because they think, because we've talked about the competition side, or Armor Gym, they may have seen online that it's, the strength facility in Knoxville, Tennessee. So they're scared by that. But so I'll always break it down. No, we know these guys, whether it's I'm sending to physical therapy or you guys, the specific people I choose, it's because they know how to slowly progress you, but educate you along the way of how to do it appropriately and safe, so then you can keep doing it forever.
Gentlemen, thank you for your time.
Yeah, man.
It's good.
If you enjoy what you're hearing and you want to put this into practice and get moving and functioning better, you can commit to 4 weeks. We can get you back in action, get you moving better. Visit thebackinactionpodcast.com. We have some program that we can invite you into and get you moving and feeling the way you want.
Thank you for watching. Join us for much more where that came from. And when you get a chance, follow us on Instagram and YouTube at Back in Action Podcast.